Okay, thank you very much. It's a pleasure to be here, and I really thank the organizers for the opportunity. I'm at the Institute of Optics at the CSIC, which is the National Center for Research. Is the largest research center with many institutes in the country, where there are over 15,000 employees. Our major interest in imaging is the eye. So I will be tackling first some of our developments and applications of ocular optical imaging, and then in the next talk, I will be referring to some optical corrections that are benefited from these imaging techniques. So our major area of interest is the development of optical imaging instrumentation for diagnosis of the normal pathological and surgical eye at various levels, and that includes microscopic level, structural, optical, and functional level. And the ocular conditions of interest include refractive errors. So we're asking questions related to myopia development, how myopia develops, presbyopia, which is the loss of the ability to accommodate, to focus near and far with aging, and corneal pathologies, and of course their treatments. So what we use as systems are, for these projects, include normal observers, human patients, and we do that in collaboration with a number of clinical institutions, animal models, and also in vitro samples. So in terms of methodology, we develop optical technologies, and this includes the optical setup, the control, and the optical processing of the data we gather. The custom-developed instrumentation in our lab includes wavefront sensing. These are actually techniques that are inherited from astronomy in some cases. Optical coherence tomography that Professor Fujimoto mentioned before, microscopy, and that includes confocal and nonlinear microscopy, and adaptive optics. The eye is a very multidisciplinary area where physics, optics, ophthalmology, but also neuroscience and psychology gather. And in that regard, we also use psychophysical techniques to test function. And of course, we use image analysis and quantification techniques. Some of our results, or you can say products, include optical instrumentation for ocular imaging, an integrated description of the ocular components of the eye, and that includes optics, structural description, biometric, and also biomechanical description of the cornea and the crystalline lens of the eye, as well as optical instrumentation for vision and functional measurements. So what you can see here is images with OCT or other techniques of the crystalline lens, the cornea, the iris. This is an accommodating crystalline lens of an eye, of a patient, focusing near and far. Or this is a technique based on adaptive optics that allows to compensate for the imperfections of the eye and provide the eye with unprecedented resolution. As for a wish list in this area, we're interested, of course, in translating all this instrumentation that we develop into the clinic and into the industry. So an item here in transfer of these imaging and optical technologies. Of course, expand collaborative initiatives in the field of high-resolution imaging, including nonlinear microscopy and OCT in the eye. And I might say that I have long-term collaborators in Boston, and through this initiative, these collaborations are expanding and increase the human resource critical mass to increase the impact of the laboratory output.